The COVID-19 pandemic has affected all aspects of life. Statistics from the United Nations Population Fund have shown that a spike was recorded in gender-based violence, unplanned pregnancies, and a lack of access to contraceptive services during the lockdown. Now, the pandemic has and is still taking a toll on the mental, psychosocial, sexual, and reproductive health of young people, and there is a need to provide support for them. The UNFPA Lagos Youth Participatory Platform is now gearing efforts towards addressing these issues by providing support services to youth in the state. Joining me now is Communication Lead, UNFPA Youth Participatory Platform, Funmi Taiwo. Good morning.
Good morning.
Thank you for joining us at TVC Breakfast.
First,
when the pandemic started and the rules for social distancing, isolation, and all of that came, it came as a huge shock because we talk about culture shock and all of that, because the life we live in Nigeria, so to speak, is communal. Definitely. And when you tell people not to associate socially, it comes with its own challenges, so to speak. And so it affected people differently. Talk to us how this has affected the youth.
Okay. First of all, thank you for having me.
You're welcome.
We've noticed that during the pandemic, and then especially during the lockdown, there was some sort of pressure on young people to, engage in productive activities. But then the question was, for us as social beings, it was new, having to stay away from people, having to take away social activities. Yeah. And then it was more like we're trying to adapt, but it wasn't so easy. So you find situations where young people, we're hearing things like, ensure that you use your time for meaningful activities, engage in activities. If you're not taking this webinar, you're not using the time.
So that pressure was on.
It was. But meanwhile, we're trying to get used to this phase. It's something we've never had to deal with before. So the pressure that came with, the advice to use the time, to be productive with the time, we could see that a lot of young people were breaking down as a result of that. And also, you see, because of the school closure, there was the situation where young people could not reach out to those in their networks, those who they would readily speak to, because we find that, they could not readily talk to parents about certain issues. And then when they were outside of that social space, what it led to was some sort of mental detachment, and then the fact that they had to handle so many things on their own, and there was no support system that as they would like. And that's why, we came up with this initiative that you're working on, because we know that, the mental and psychosocial well-being of young people is pivotal to their overall health and well-being.
But one would have expected that such a time when you are with family, because a lot of persons were working from home.
Definitely.
It would be a time to bond.
True.
But then, what really was the challenge?
Okay, so the challenge was, like I said, everybody was still trying to adapt, parents, young people, and in as much as some people were at home, it was also a negative thing for some others. So in a situation where somebody is being abused, and then you have to be in the same space with your abuser who could be your parent or a close family member. So like you would have noticed, there was this spike in gender-based violence. People were beginning to...
So quickly, if I may interrupt because of our time.
Yeah.
So how is this program going to help people who find themselves within this bracket?
Great. So what we are offering is a referral service, for the mental health services, reproductive health services. So in a situation where you lack access to contraceptive services, we refer you to places where you can get them. And then if you need to speak to a counselor, if you notice, you're going through a mental breakdown of some sort, you call in, and then we have young people like me, young people like the callers, take up the calls, and then speak to them and see if they actually need all of these services, and then we link them to partner organizations, so to speak, that we're working with on this project. And for little or no amounts, you can get access to all of those services that you need, especially in the area of mental health. You know, we have we also have centers that are dedicated to providing COVID-19 palliatives, because we've also had people, you know, calling in for something like that. So it's a whole spectrum, you know. We can't just attack an issue without looking at everything.
So anyone can call, or
Definitely.
is there an age bracket?
Okay, so there's an age bracket. The UN defines, you know, the age for young people as 10 to 24. So that's our age bracket that we're looking at. Every age group in that bracket, every social group in that bracket. Youth living with disabilities, young people living with HIV, because we understand that these target groups, they've not been adequately captured in the COVID-19 pandemic, you know, relief or whatever that is going on.